Hi everyone, this is just a quick slideshow on behalf of hipflexor.org on hip flexor injuries. I'm going to start off, just give you a quick background on the hip flexor. So, as you see in the diagram here below, the hip flexor isn't just one muscle, it's a whole group of muscle. And what you'll see is the bone in the back is your pelvis, and the muscles typically all surround there. There's a few that are on the back of it, but most of the main ones are on front of it and attached to it, like you see here. Main muscles are the iliopsoas and the tensor fasciae latae. And when we talk about hip flexor injuries, you could have like a pulled muscle, and it could be any one of these muscles. That's why it's one of the harder injuries to kind of diagnose, but you can still perform certain tests and figure it out. So basically there are three types of injuries. One are contusions, and these are as a result of blunt trauma. You could also group kind of bone fractures in the hip, your femur, which is your thigh bone that connects at the hip. And these typically aren't a big deal if you're just looking at normal bruises. Nothing serious. They might be a little tender, but they'll go away in a few days. You can have your pulls and strains. Okay, this is when you're overextending yourself, overexerting yourself. Maybe do something really explosively in some kind of sport, and you pull your muscle. And there's different levels. And if it's a minor one, it's not a huge deal. It'll heal in a few days. But a severe one, you could have torn a significant part of one of the muscles, and it could be something you need to get looked at immediately. And then finally, there are conditions, which are basically things like tendinitis and snapping hip syndrome, and things that come as a result of overuse. Um, Now, again, you have to diagnose these differently, but for the most part, they're treatable and usually caused by just doing too much too soon. If you're trying to ramp up your training schedule, if you're an athlete or something like that. So I'm not going to go into everything here, but we have lots of articles at hipflexor.org, so check that out. If you go on the site, you'll see that there's a free injury guide on the menu above at the top of the screen, and you can download that. You don't need to give anything to download it. It's just we want to get the information out there. And basically, if you're not sure, go see a doctor. It doesn't hurt, but there's plenty of self-help things on the website if you're in some sort of situation where you can't see a doctor right now.